All right, everyone. Thank you so much for hopping on. My name is Ransom Nima. I'm fourth year radiography student based in Nigeria, and I'm also a proficient medical writer and also a YouTuber as well. So today I have an amazing guest speaker all the way from the UK. Her name is Ruby Jackson. Hey, Ruby, could you introduce yourself to the audience?
Hi, my name is Jackson. I am an NHS Clinical Entrepreneur, founder of Melanatal, which is an app that's going to be launched later this year, hopefully. And I'm also a student midwife. I've just come to the end of my training, so I'm due to get my PIN in September.
Mm, mm, amazing. So, Ruby, thank you so much for being our guest speaker today. So, we have a couple of questions for you to answer. You ready?
Yeah, I'm ready.
So, a little disclaimer out there: I've written the questions for Ruby to answer or to share a narrative on these questions. So, if I'm looking downwards, I'm reading the questions to Ruby. All right. So, you guys will be wondering why am I always looking downwards for? So, Ruby, the first question for you is what really inspired you to become a business practitioner, focusing on maternity services in the NHS? Talk us through.
So I have quite a sort of journey of how I got to sort of creating and thinking of the idea for Melanatal. But what really set it off was in my third year, my final year, which I've just done, when we did our dissertation. And we had the opportunity to either do a literature proposal, a research proposal, or we could do a practice change proposal. And basically, we would be sort of implementing a change within practice. So we'd sort of identify a problem and then bring a solution. And I think I'm just such a advocate and champion for making change. And I think innovation, thinking of ways we can, yeah, change things. That's kind of a really big passion of mine is driving change.
When you talk about the business aspect in terms of your work, as maternity service provider in the NHS, how do
Yeah,
you how do you combine those works? Because you work in the NHS in the maternity department and also an entrepreneur. So how do
yeah.
you those things?
So I think really for me, the kind of door that's been open to all of that was the NHS. So the National Health Service, which we have here, um, that has been sort of the gateway, the NHS Clinical Entrepreneur Programme. So it's great because it's for clinicians and they've recently opened it to patients as well. And it's all about like, do you have an idea and innovation which can create change within the NHS and kind of beyond as well? And for me, that's been the gateway because it's combined my clinical practice along with my sort of entrepreneurial ambitions. Um, and it's been a great sort of there's educational sessions, we've had chances to meet industry experts, and yeah, it's been that for me has been the kind of segue into the entrepreneurial world.
Okay, so talk us through before we move to the next question. You know, tell us what really inspired you to focus on the aspect of maternity services. Talk us through what was the behind the scenes and made you to say, "Hey, I want to go into this field."
um Honestly, all I've ever wanted to do since I was about 8 years old. And now like all my friends and family are like, oh, you've finally got there after like years and years, because it's all I've ever wanted to do. And I think for me, uh, just facilitating it, I think it is completely life changing. Bringing life into the world is how, how we all got here. It's the very beginning of life, and also supporting people if they're having, it's not always sort of sunshine and rainbows. There can be really difficult times as well, and kind of either way supporting people through that life cycle, whether it's the beginning or sometimes sadly not. And it's for me just being that support and also advocating for someone through what can be a really vulnerable time. And just I think we have such a pivotal moment in that start of life to really make a difference to how someone's life course goes, and for both the birthing person and the baby too, and the family.
Wow. Thank you so much for talking us through about the behind the scenes of what really made you to choose that part, which is an amazing stuff to do. And so the next question for you goes this way. So can you share some of the key challenges you've faced in promoting change in parenting services and how you have overcome them? Type of stuff.
Yeah, sure. So being completely transparent, right now I'm not at I'm like pre-pilot stage. I'm still actually developing the app. So I've not sort of actually implemented it yet into practice. But the sort of barriers that I've because I did a whole dissertation about melanatal, sort of barriers that I'm anticipating is obviously massive cuts, especially within the NHS, massive cuts on what sort of like financially where the money can be put and things like that. So I think just the cuts that we're currently facing here will be a big challenge. And I think sometimes changing the culture can be quite challenging of any workplace, implementing change to within embedding it within a culture and also at an institutional level. That can be hard to change. Things, but I think mainly just, yeah, facing massive cuts which have come around, especially since COVID. Yeah.
Oh, so you thank you so much for sharing us about talking us through about the challenges you face in promoting change in the parenting services. So tell me, what are the strategies you're using to quench those challenges out there in terms of parental services and how you've use that platforms like for instance the social media
Yeah,
or the platforms you're using to quench that challenges in terms of the parental services among people.
I think so. One of the challenges that I just spoke about in terms of like cuts and things, um, I think one of the key things that is really driving and backing the melanatal, the project altogether, is the fact that it's just something that's utterly essential. The research is there, the figures are there, both quantitative and qualitative data is there to back why, why we really need to make this change. And I think that's something key. If you have kind of the research there, it's an abundant problem. It's now, it's a massive public health issue now. And I mean, it has obviously been for years, but now we actually have the research there to back it, and we know what needs to be done to change it. So there's kind of no, I think it will, that it's very kind of, the research is there to back it, and I think it's something that will massively could help change public health and reduce those health inequalities. So for me, having that research under my belt has been really kind of pivotal in backing the idea and overcoming that barrier of kind of like, obviously there's pots of money that need to be put in places, and kind of what do we need to focus on implementing, and it's like this is a clear problem, and it's also been identified worldwide that this is a clear problem that needs to
Mm,
be.
mm, mm. So talk us through about the app you're working on right now. So that people can get a little glance about what it's all about. So talk us through.
Yeah, so I'm still currently in the development stage, so I don't want to sort of give away too much, and then it could all change. And obviously, apps change completely over time. And it would be great actually if you look at my website. It's called Melanatal. If you just search Melanatal, and you can find out more info there as well, and on our social media pages, which I'm just sort of making now. So the app I'm creating is an educational tool. So for clinicians such as midwives, student midwives, nursery nurses, even doctors, any sort of clinician that's within maternity services and neonatal care, and also service users, so birthing people, partners, family members, and it's around how maternal and neonatal conditions present on black and brown skin, and also beyond that, kind of it discusses a range of signs and symptoms, which is a key thing for me, having a toolbox specifically for Black and brown people to access health information and education on not only the visual presentation, but also just education more about the key signs and symptoms to look out for, and also of a range of conditions, but also conditions that disproportionately affect people from those backgrounds.
Mm, mm, mm. Thank you so much for talking to us there about the development of your amazing upcoming app very soon. This is an amazing stuff you're doing. Kudos to you, and I
Thank
wish you all the best. Yeah. So the next question for you is: so what new methods or technologies have you used to improve maternity care in the NHS? Talk us there.
So, as I said, I've not actually yet launched yet or implemented the app anywhere. It's at kind of early, very early stages. But I recently won the Digital Health Priority Population Challenge, which was with Cognis. They're an amazing platform, and they're a low, no code kind of platform which you can create an app on. And it's been absolutely amazing working with them. It's just been great. It's a really kind of so it's with Cognis Academy, and it talks you through step by step how to kind of approach things. The team have been so amazing and supportive, so that's kind of the platform I've been using. And I think the sort of no code technology has just been great, and all of the support has been invaluable. So yeah, kind of props to Cognis. They've been amazing, and also the Validitron as well, partnered, and AWS as well.
Mm, mm, mm. So, you've been an amazing guest speaker thus far, and before we proceed to the next question,
Yeah.
talk, us- talk us through, in your own perspective, how is the NHS in the UK right now going on in terms of your work you offer in the table?
Sorry, could you?
I'm saying, how is the NHS in the UK right now? How does it affect the kind of work you offer to the table?
Oh, okay. Yeah, there are a lot of faces, obviously, everyone knows facing the NHS, for example, like service cuts, like money wise, as well as burnout is a massive issue amongst staff. And I think with obviously burnout, that affects patient care and outcomes. So that's a massive challenge. Everyone's very burnt out. Staffing is kind of poor. Poor attrition is quite poor. So those are some of the challenges that we're really facing here. Massive, yeah, service cuts with staff and shortages and things like that. So I think those are kind of some of the key issues that we're facing here. Yeah.
Okay, so that brings me to the next question for you. So, how do you work with other providers and stakeholders to ensure your measures are effective and sustainable? Talk us there.
Yeah, so that's a great. I've had a great network joining the NHS Clinical Entrepreneur program. It's meant that I've met a range of people from different backgrounds, which you might necessarily not. Um, I might have not necessarily had the opportunity to do if it wasn't for the program. So it means I've networked with a range of like researchers, doctors, nurses, midwives, people from a range of different backgrounds, people that are involved in patient engagement and involvement, which has been great. And I've done that with the Happy Research Group, which Gemma Poole um, is the founder of, and that's been amazing. And I've got some upcoming work with her that I plan to do. So that's been great because that door might have not been opened if I hadn't have got those connections. So I think utilizing the network, and we always say, like, collaboration is key, and kind of helping each other open doors, and always as well involving, for me, co-production with the communities that the solution is going to address is key. I think there's no point making a solution sat on a helicopter view. You really need to be on the ground floor, knowing what needs to be done, speaking to the people, speaking to whoever the stakeholders are that are actually going to use the app. I think sometimes when we think of stakeholders, we're just like, who can we have, for kind of to like actually create the app, or who's going to be, sort of investment things and things like that. And I think we need to focus, and a lot more, and the best solutions do focus massively on involving the service users and, in my case, the clinicians that are going to use the app as well.
Mm, mm, mm. Wow. When you mentioned about networking, people are really confused about that statement. So, where do you think is the most appropriate place to network? Is it what platforms do you suggest that people can, clinicians or other healthcare providers out there can, you know, be on to network with a very amazing connections out there, in terms of their own works they offer to the table. So do you have any other like advice for them on platforms to join, to increase their networks?
Yeah, well, for example, now we're networking online, so I would say there's resources, online platforms, LinkedIn, Instagram, YouTube. There's loads of online communities. Obviously, I know kind of if you don't have access to technology, that might be a bit harder, but there's, if you even wanted to go to your local library and access it through there, that's a sort of starting point. So online platforms are a great way of networking if you need to do it remotely, or you're kind of in different countries. That's a great way, especially now. I think since COVID, we've really utilised those online platforms much more. In person, there's loads of events too, like healthcare events, which you can, if you kind of just look online, there's loads that I've been to. And again, obviously, I've had those great opportunities through the programme, but there's always external candidates as well that can come and join those sessions, or if you look on like Eventbrite and things, there's great events that are both in person and online. So what I really think about is just kind of reaching out, doing your research, having a look. Also, reaching out to people, just messaging them like you have, and why I'm here today. Just kind of reaching out. And I know sometimes if you're kind of new to networking, like for me, this has only become something at this year that I've joined the whole world of kind of like networking and speaking to people a bit more. So I think that kind of just taking that plunge, and you have to start somewhere.
Yeah, absolutely. I do agree, and I believe that they now know some platforms to increase their networks, which is very
Yeah.
important. You mentioned about LinkedIn, Instagram, YouTube. These are amazing platforms you can, you know, generate a lot of networks, in your niche and beyond your niche as well. So the next question for you, Ruby, is can you talk us about any success stories or highlights that have emerged from your efforts to improve parenting services? Talk us through.
I think for me, doing my dissertation, which then led me to kind of, for me, it was that one moment of reaching out to someone, and then that opened the door to the next person, and then that opened the door to me joining the NHS programme with pitching my idea for my app, because I think if you have, we can't tackle all of the problems ourselves. We can't try and find solutions to everything. But I think if you have one thing that really, like, it's a light bulb moment that you're like, that I can see a problem and I can see a solution. And for me, it was the lack of representation of Black and brown people in medical literature, medical illustrations. And that was something for me that we know representation improves outcomes. It's clear when we don't know better, we can't do better. Whereas when we know better, we can do better. And with that education, we can do much better. And for me, it was getting onto the programme, and then the doors opened. I then applied for the Priority Population Digital Health Challenge, and I pitched with people that were kind of based in the various places. And it was just winning that challenge alongside someone else. That was just amazing, because it kind of just validated the idea, and then also gave me the platform to bring the concept to life. So from the kind of idea to now bringing it to life. And I think for me, that was a real success and a moment of like, yes, this idea is really important. It's not just an idea, it's like a real pragmatic solution that could create amazing change. So for me, that was just a massive success, going from as a student having an idea for a dissertation, doing the dissertation, getting on to a program where I'm networking with amazing people, learning so much, and then winning that competition was just amazing.
Mm, mm, mm. Wow, that
Um,
was an amazing,
but
amazing
yeah,
success.
I think for me, the real success will just be if, even if, who knows where the app can go, you never know what can happen with these kind of things. But for me, the real success will just be if I can positively improve people's experiences in our services and people that experience health inequalities. That for me will be the real success. And that's why I'm doing this, is to really try and improve mainly the experiences, because although obviously the outcomes, that for me is something later down the line that we'll be able to see with data and stuff and see if those have improved. For me, improving people's experiences in the early stages and making people feel seen and heard, valued, and that change is coming, and that we can improve the care that we give through solutions like melanatal, that will be the real success and win for me.
It's amazing to hear that you have the people's interest in your heart, which is an amazing stuff to do.
Yeah.
And I, I know that you're gonna do really well with your ongoing project because your project you did, your dissertation is a testament of what's coming on, in terms of your ongoing project. And I know that you're gonna touch lives as your dissertation did, because I've been following your journey for a while now, and it's just amazing that you're doing so much you're doing right now, especially having people's interest at heart, which is an amazing stuff. And I know that you're gonna do very well, and all I'm wishing you right now is success all the way. And I know that I'll be here to jubilate for you when your app is live, and also people, the audience as well, are gonna be expectant about the app coming on in a few months or days from now. So the last question for you, Ruby, is, so before I ask you the question, talk us through. Tell us more about your university you studied, and you know up until now, your challenges you faced, and up until now, what are your next plan? After you're done, because it seems like you're done right now, right? And to tell us through what was your challenges in the university. Talk us through the name of the university in case people wanted to, move into that university as well. So yeah. So after that, you're gonna move to the next question.
So I think some of the sort of challenges in university itself, I mean, I had a great experience at my university. But I think when we joined, my cohort was 2021. So it was kind of at the tail end still of COVID. And, when we joined, everyone was like masked up. Like it was quite a different experience for both us as clinicians, but also for the people using our services, so the birthing people and families. There are a lot more different kind of rules and regulations. It was, people couldn't have like two birthing partners, so kind of I think the emotional aspect of it was quite difficult at the time. And also just, you notice things like having a mask on all the time. You can't, I'm a very expressive person, and like I'm quite a smiley person. I feel like someone's kind of smile can really bring like a warming kind of energy, and I found that quite difficult, not having that kind of human connection as much by being all masked up, and it was quite a lot more separate, and there are a lot more kind of barriers in place in that kind of sense. So that was quite a struggle coming into that as a student. And obviously as well, we are, since COVID, the cuts and the knocks back to the service have been kind of just snowballed. So I think kind of just joining it at that really difficult time post COVID was kind of a struggle. What else would I say? I think for me in my third year, obviously, this is when everything's kind of just happened all in once. So doing my dissertation, then joining the program, and then winning the competition and trying to sort of start developing an app. And I think all of that, we're on placement, then we have uni, essays, everything, as well as juggling this kind of side of things as well. And developing and creating the app has been quite difficult, like time management wise. And for me, I'm someone who's never kind of this is my first like business kind of venture. So I would say I'm doing a lot of learning, and learning, although I love learning, absolutely love it. We learn something new every day, and I just love education. It is obviously quite like tiring, so I think that can take a toll, juggling so many different things at once. So I think those would be my main struggles, but I think actually things that I've done to overcome that is really like leaning on people, climbing with people together, and using my resources, my support network, both family and then obviously like the professionals that I've met through um, the opportunities that I've had, and really utilizing a network of people that I've built.
Mm, mm, mm. Amazing. Thank you so much for talking us through about the things you faced while in the university, and I believe that that would be an encouragement for people as well. Facing what you faced already in the past. So the last question for you, Ruby, is: so what do you think is the biggest challenges facing maternity care in the NHS today? What are your thoughts on that?
Yeah, so I've discussed kind of some of the challenges in terms of a like a kind of level of like, we know that staffing's poor, there's cuts to services in terms of money. Um, but I think in terms of what melanatal addresses is the one of the big massive challenges is the disparities in health outcomes amongst, so Black women in the UK are 3.7, so nearly 4 times more likely to die in pregnancy, childbirth, and postpartum than white women. And women from Asian backgrounds are 2 times more likely to die in pregnancy, childbirth, and the postpartum period. And this also poor outcomes amongst babies and neonates. So Black neonates now have the highest rate of stillbirth and neonatal mortality, and these have actually been the highest. I think it was. I can't say for 100%, but I'm pretty sure it's since 2017 that if you look at the graph, it's gone up. And for me, that is a massive challenge that I melanatal looks to address, is those really stark disparities in outcomes, and also reading the it's some of the experiences that I've read of Black and mixed women in our services, and mixed heritage women in our services, have been truly heartbreaking. There was a report that was published by Five Times More campaign group, and they published experiences of, I think it was around over 3,000 women's experiences within our services, and many women reporting feeling like, not seeing that their symptoms and the signs and symptoms of really harmful conditions were either missed or not taken sort of seriously by clinicians. And for me, that's something that we need to do better as a service. And actually, I think we need to, as a service, though, we need to provide better education to the clinicians within that service as well, on how to identify those conditions and bring more awareness around conditions that, as I said, disproportionately affect brown people.
Mm, mm, mm. Wow. Thank you so much, Ruby. You've been an amazing guest speaker thus far, and I know that the audience can testify about that. And we've come to the end of the session, and thank you so much for sharing your narrative on these questions. And I believe that the audience are really encouraged and really enlightened. So before we wrap up the session, what are your last words for the audience?
Well, yeah, just keep your eyes peeled for melanatal, and yeah, let's just create change. Yeah, and look, so kind of, yeah, always looking forwards. So yeah, just looking forward to hopefully driving good change
Yeah,
within us.
absolutely. So you'll be really expectant for that, because it's gonna be an amazing, app that can help a lot of clinicians out there and a lot of healthcare workers as well. So if you love this content, do it to like, share, and subscribe, and also share to your network. Hopefully, someone in your network will really need this video. So thank you so much. Thank you, Ruby.
Thank you for having me.